Hello, I'm Greg Stock. I'm the CEO of Thibodaux Regional Medical Center. It's a pleasure today to be here with you and with Dr. Eric Greber. Dr. Greber is an expert in orthopedic surgery with extraordinary training in hip and knee reconstructive surgery. And today we're going to learn a little bit more about that. As we begin today, though, I think it'd be great if Dr. Greber would introduce himself and then tell a little bit about your training and education.
Hi, I'm Eric Greber. I am an orthopedic surgeon here in Thibodaux at the Thibodaux Regional Medical Center. I grew up in the northern part of the state in Shreveport and have moved down here to start practicing and work with this hospital and this community. I originally did my undergrad training at LSU and also did medical school at LSU, and I moved to Arkansas to do 5 years of orthopedic surgery training. Then I decided to do an extra year of fellowship training in hip and knee reconstruction in Salt Lake City, Utah, which was a great experience. And it really allowed me to focus more on the conditions that I want to specialize in, which is hip and knee replacement.
Dr. Greber, fantastic training. I know I was involved with your recruitment. It was a pleasure to get to know you and your wife too. I also want to just mention that you learn a lot about physicians in the recruitment process, and one of the things that speaks well for you is that the professors there at the University of Arkansas Health Sciences wanted to keep you there so that you could become a teacher, somebody that can teach, somebody that can articulate, somebody that's really good at what they do, the kind of people we like to be associated with. So again, we appreciate having you here. That expert training of yours has allowed you to treat certain diseases and conditions. Maybe could you talk about that for a moment or two and explain it in a little more detail?
I focus on hip and knee replacement and problems around the hip and knee. Mostly this is arthritis, and whether it be osteoarthritis or rheumatoid arthritis. Also, people have injuries that cause their hip or knee to start having arthritic pain later down the road, which is called post-traumatic arthritis. Some people are born with deformities that lead to problems around the hip or knee that can need intervention later down the road. So that's mostly what I focus on. I also focus on painful hip and knee replacements, infected hip and knee replacements, or any hip or knee replacement that needs further work on it later down the road.
And you know, you've been on the leading edge of this, your training and your desire and your expertise. And so what we're seeing is these very, very short lengths of stay in a hospital because the procedures are done so expertly, and the pain is really incredibly small compared to what it used to be. I think a lot of patients go home with an aspirin, for example, almost within 24 hours. Would you like to comment on that?
I do think that as we go along and learning more about hip and knee replacement, that we've found out better ways to manage pain with multiple different medications, which doesn't always mean pain meds, which has really helped patients get back to life quicker. And I have been privileged to learn from some great mentors in this field to teach me and help me learn to develop how to bring these new ideas back to Thibodaux.
You're doing an outstanding job, in my opinion. I know you've helped a lot of people already. That's our purpose, is to help people and do it in an excellent manner. So thank you for that, and thank you for bringing your family to Thibodaux, Louisiana. In our next session, we want to talk about minimally invasive procedures. That's going to be interesting too.